had a couple more questions today, and then I'm going to go through the protocol for chronic conditions using the example of PCOS or endometriosis. Somebody asked for clarification about the breathing, and it is okay to speed it up or slow it down. The most important part is that you actually get the pressure and you take the time and you breathe. So you can just breathe normal. You can speed it up. And there are two specific ways that they teach breathing. There's fire breathing, which is focused on the exhalation. So that sounds like this. Breathe through your nose, but just so you can see, you're just blowing out. And then the inhale is sort of a reaction to the effort that you're putting out. And it just sort of naturally comes back in. So you could press quick. And you can get through your 12 or 36 real quick. You can also emphasize the inhale, so you're sucking in a full belly breath. Or you can just breathe normal. As long as you're doing it and breathing, you're doing it right. But play around with some of the variations. Another question I got was, how do you incorporate the emotions in that? And that happened very naturally for me. So all the meridians have emotions that are associated with the meridian. Water, bladder, and kidney are fear and paralyzed. Those emotions are indicated on the little color map that I have. And so what would happen is I would be pushing on a point in a treatment with a patient, and I would get a feeling. I knew what the emotions were related to this meridian, and I would ask questions. What do you really need to let go of in life? What are you most sad about? What area of your life are you feeling stuck in? Tell me about your mother. Things that would get them talking and expressing the emotions that are related to that. That's all you really need to do when you're pressing on the point, is do a recall of some of the emotional experiences that you've had. Stuff should come up naturally as you do this. Like when you're pushing into a point and you're feeling some pain, maybe some sadness naturally comes up and you just allow it and think about what's going on or what that comes from. When you're pushing into the local area of discomfort and you find something very tender, think about what that might represent in your life. Think about symbolism. What does your shoulder symbolize? Reaching for things, the loads we carry in life. So let that happen pretty naturally. Let it come up when it comes up. And if you want to incorporate emotions quickly, when you're doing the face points that go into that, just use the emotion right there. When you're tapping, think about sad and stuck and just whatever comes up first for you. And then people ask, how do you pick a point or use this process with a chronic condition? So I actually have this study on PCOS and endometriosis that are using essentially the same points. And so what they did is, PCOS has multiple problems. It's got the testosterone, the cycle irregularity, so they picked two main points. Spleen 6, which is on the inside of the leg here, 4 fingers up from the ankle bone. That's the one that's used the most for hormone imbalances and problems with your cycle. Then they used liver 3, which is that point between your first and second toes. You slide up in between the bones until the bones come together and you push into that point right there. That's the point that is used for cleanup and organization, things being out of order. And so the cycle is out of order, hair's growing in places it's not supposed to. So that order is exactly what this condition needs. For endometriosis, they also added the letting go point. And so we'll go through this. They did include the local points. They did not include the face points, so we'll add that. But they did stimulate the local points. 4 fingers down from the belly button. You just put 2 fingers in there and you push right there. What I would do if I were treating this condition is I would put this on my bed, get that right over that position, and just lay and breathe. Maybe roll around, because there's a couple points in there that are helpful to this. So just breathe and roll around. And you could incorporate the tapping while you're right here. The pink points go down the middle, right there. And so you're already pushing on the local area while you're tapping with the ball. And then under the eyes, the yellow points go right down the sides there as well. Do your 12 breaths, 12 breaths. And then you can do the top 30 points. So spleen 6, inside of the leg, can actually do both of them at the same time here. Push and release with your breath. If my uterus were sick, I'd probably be putting some pretty good attention towards it, or ovaries, or any part of me. I have little aches and pains associated with being over 50, and I give them attention every day. I want to improve my metabolism over 50, so I give that attention every day. So just breathe and push Liver 3, breathe and push, 12 breaths, 36 breaths. What you're going to find is that if you start lower, even at 6 breaths, if it seems like a lot to begin with, especially if you do it slow and mindfully, because you're not used to sitting still, or if you feel kind of awkward or uncomfortable sitting still and doing the breaths, just start low and build up. You'll see that if you do 6 for several days, 12 won't seem so bad. And when you do 12 for several days, 24 won't seem so bad. And you'll get used to really focusing on yourself, and that's a good practice to develop. That's a good habit to develop, good skill to develop. So push and breathe. And anywhere you can coordinate, save time, and you want to do 2 at the same time, you can certainly do that. And then for endometriosis, they added the letting go point. Again, if I had a problem that was kind of serious like this, I would do more versus less. You're not going to hurt yourself doing these things. And as you do them, you'll probably get a sense of what really is helpful. As long as you're being mindful and you're breathing and focusing on your body, we want to stay present in this healing session because we're only asking for a few minutes. If we do 12 breaths on the ball while we're tapping, and then do 12 breaths here and 12 breaths on our feet, we're only really talking about 3 to 5 minutes. So practice being mindful and in the present moment, focused on yourself and your needs. That way the emotions might come up that you need to get moving. Especially with PCOS, I would consider doing the metabolism points, stomach 36 on the front of the shins here. And anything else that you read through the top 20 sheet and go, gosh, that sure sounds like me. I'm in a really dark place and I need to see some light in my inspiration. I've really been hurt and I need to bring warmth back into my body. Triple heater 6. So whatever applies to you specifically.